Hi, everybody. For week 14's clinical conference, I had the pleasure of seeing MA, who is a 19-year-old female with a past history of anorexia nervosa, binge purge type, retinitis pigmentosa, depression, anxiety, and she presented with weight loss and weakness. She presented to us through the emergency room with her parents. Her parents dropped her off there, and they were looking for some help with her because she has been deteriorating. She's been sleeping all day. She hasn't been eating and continuing to lose weight. So she was admitted to the University of Michigan in the Mott Hospital for the eating disorder protocol. So initially, when she was started on the eating disorder protocol, she was not compliant with the protocol whatsoever and refused to eat any of the meals, and she required being restrained while having an NG tube placed. And because of her agitation and irritability and just aggressiveness during the refeeding process initially for the first, I'd say about the first 3 to 4 days, she even required some PRN medications. But after a few days of receiving the tube, she started taking in 100% of meals and snacks PO, and we were able to remove the tube. And now she is taking in all of her meals and snacks on time and has not required any supplementation. So we went to go see the patient today, and she still continues to remain compliant with the eating disorder protocol as she is eating 100% of her meals and snacks provided and has been not requiring any supplementation. Her vitals have been stable over the past 24 hours, and her weight has increased to 48.4 kilograms since her admission weight of 45.8. She says that meals are going good and denies having any emesis with meals or snacks. Prior to her compliance with the eating disorder protocol, she was intentionally causing herself to have emesis after meals in an effort to not gain weight. So she has since stopped doing that, and she continues to take it 100%. She is, however, experiencing some anxiety and depression over the past several days due to her weight gain, and she says that she feels like a failure and she feels really sad and depressed because she's gaining weight. We encouraged her to continue to be compliant with the eating disorder protocol, and we educated her about mitigating nutritional effects on anxiety and depression, and she was accepting of this education. I also did try some CBT therapy with her before, but she wasn't able to really receive the intervention because I think because she's blind and she refuses to wear her glasses because she said that somebody told her that she looked like a bookworm a long time ago. And also, too, because she's just not in a good place cognitively to receive that type of intervention. Like, her brain is not in a place where she can understand CBT therapy at this time. So she continues to lack insight into her disease. And the plan for her, she's going to go into a residential eating disorder program, and she has an intake tomorrow afternoon with her mom. So for her diagnosis, Access 1 is anorexia nervosa, binge purge type. Access 2 is deferred. Access 3 is bradycardia, hypotension in the setting of anorexia, blindness, and polyneuropathy. Access 4, she's worried about gaining weight and she feels like a failure. And Access 5 is 35. So I found a research article that talks about food addiction in the anorexia nervosa population. And it says that people who have anorexia nervosa binge purge type have a higher prevalence of of food addiction in comparison to people who have the restrictive type. So the actual addiction to food also has to be addressed as well in order for us to get, fully approach in order to fully what's the word I'm looking for us to fully address all of the issues that the patient is having. All right, let me know if you have questions. Bye.